Open defecation is the human practice of defecating outside in the open rather than in the toilet. It could be on the fields, bushes, forests, rivers, canals, ditches, or other open spaces either because of inaccessible toilet facilities or due to archaic cultural practices. Nigeria, often regarded as the giant of Africa, is one of the nations of the world where open defecation is still being practiced. Recent report provided by the United Nations Children's Fund, UNICEF, indicates that about 48 million persons in Nigeria still engage in open defecation, which has remained a significant contributor to the spread of about 17 neglected tropical diseases, NTDs. It is with a view to making Nigeria open defecation free that the United Nations Children's Fund, UNICEF, organized a 2-day media dialogue on ending open defecation in Nigeria and elimination of neglected tropical diseases, NTDs. The media dialogue brought together stakeholders from both the public and the private sectors who had a panel discussion and shed light on the intricate relationship between open defecation and the spread of neglected tropical diseases such as trachoma, lymphatic filariasis, among others.
We have endemicity, so that means we're affected by at least 5 or 6 of the NTDs, which is a group of 20. So things like intestinal worms, like snail fever, trachoma, river blindness are some of the diseases that affect Nigerians. But like I said, they can be prevented, they can be treated, and that is what we are laser focused on doing.
In her opening remarks, UNICEF Chief of WASH, Jane Bevan, warned of a looming health crisis in Nigeria as 200 million citizens are at the risk of contracting NTDs. Just as she highlighted the urgent need to address open defecation, Bevan noted that practicing hand washing with soap and running water is perhaps the most affordable immunization that all Nigerians, including pregnant women and children, can receive that will assist to save lives and avoid the spread of NTDs.
Many of the neglected tropical diseases are transmitted through water or through poor sanitation. So unless we all practice safe sanitation and safe hygiene, there is a risk that we will all get more neglected tropical diseases. UNICEF works very closely with the government and with the Clean Nigeria campaign to really make a difference on the ground. We're working in several states. As has been discussed, we've already managed to achieve 126 open defecation-free LGAs in the country, and there's many more that will now be coming up.
Similarly, UNICEF WASH specialist Mr. Monday Johnston stated that Nigeria has the highest NTD burden in Africa, and open defecation remains a significant contributor to the spread. According to him, addressing open defecation would significantly reduce the transmission of NTDs, adding that improved sanitation practices can also break the cycle of infection, protecting the vulnerable populations, especially women and children. Also speaking, the national coordinator of the Clean Nigeria campaign, Mrs. Chizoma Okpara, identified some of the challenges in achieving an open defecation-free status in Nigeria by 2030 to include infrastructure deficits, lack of implementation of existing laws on sanitation practices, weak policies, funding gaps, among others. She, however, expressed optimism that with behavioral change and increased investment in sanitation facilities, stronger government commitment, and private sector collaboration, Nigeria will achieve its goal of eliminating open defecation by the year 2030.
We are looking at more, collaboration with as many people, the media, different associations, and down the line to see that this message reaches every Nigerian, and we understand that it is a health challenge, and we need, as much as possible to end open defecation in Nigeria.
According to the WASH National Routine Mapping, WASH-NAM, Ebonyi State leads in open defecation rates, followed by Plateau State, while Zamfara State has the lowest rate, and only 126 out of the 776 local governments in Nigeria have achieved the open defecation-free status.
We really need to review this, put in place an improvement pattern on this policy, which will bring into perspective the roles of private sector, clear roles, the governance structure well mapped out in terms of who does what and at what stage, and how the private sector can invest into the eradication of open defecation.
My first message would be collaboration in how we entertainers can come in, even from animation, to creating content that can drive the awareness and drive the message.
UNICEF said it would intensify collaborative efforts with its partners to end open defecation in Nigeria by 2030 through the construction of sanitation facilities, implementing hygiene education program, and engaging communities to promote behavioral change. Oluchi Amuda for Dateline.